The V-Life with Dr. Annie is produced by Advanced Cardiovascular Care Center with educational grants from Amazing Lines, Dolce Vita Cardio Advanced Med Spa, and sponsored by In Mode Aesthetic Solutions.
Hi, welcome to Live the V-Life with Dr. Annie. Today I'm here in beautiful Abu Dhabi and I'm at the Cleveland Clinic with this wonderful doctor, Dr. Francesco Serino, and he is a clinical professor of the Lerner College, the Cleveland Clinic in both USA as well as here in Abu Dhabi.
Absolutely.
That's right?
Yes.
He's an amazing vascular surgeon and we are so honored to have you,
Thank you,
sit
Annie.
with us on your day on call. And
Thank you,
taking
Annie.
care of patients, but taking care of the world with talking about vascular health today with us.
Absolutely. I'm
So,
here.
and you're so wonderful. We love you. So we want to know from you. Tell us about yourself. I know that you're Italiano, so just give us a
Absolutely.
little
Very
brief,
Italiano.
yeah, introduction.
Yes, I was born in Rome, in Italy, and I did all my school in Italy as well, and my medical school in Rome at the Catholic University. And that's the Catholic University is one of the best medical school in Rome. And then I trained in Rome in surgery. I spent some time in your beautiful place in Houston, 3 years of my
At
life.
the Texas Heart Institute.
3 years, and it was a beautiful time, and I still have a lot of friends over there. And then I went back to Italy, continued my career, went into vascular, and then stayed into vascular until I came here to Abu Dhabi again.
That's wonderful. Now, we know that Abu Dhabi is a beautiful place. We have visited some beautiful ornamental structures here, including the
Amazing,
palace.
yes.
What brought you to Abu Dhabi and the Cleveland Clinic?
Well, you've been here in the Cleveland Clinic, so the challenge, which was actually the offer and challenging offer I got, and I accepted to try, was to open this beautiful hospital here. So this is an incredible project that was actually in the mind of the Sheikh Zayed, I think 20 years ago. He wanted to open an international renowned hospital instead to have people from this country to travel away to get care. He wanted to bring the Western medicine and the best medicine in Abu Dhabi. That's what his dream, and it was realized. So when I was called here to basically open the hospital, and in my case the vascular, I just couldn't resist, and I said yes, let's move, and I moved. I never was in Abu Dhabi before, and I just came to do this.
It's an amazing place, isn't it? Right on the sea, correct?
It's on the
view
sea.
is beautiful.
It's desert and sea. So
Desert and sea, and now has this incredible place of healing, right? Bringing vascular
Absolutely.
healing as well as others. 250 bed.
It's 360 beds.
360 bed.
And almost all specialties.
Yes.
We have all specialties in this hospital except pediatrics and gynecology. But all the rest is here now. It's running, and also it's actually we started 4 years ago.
That's incredible.
Yes, 4 years ago.
It's such a beautiful structure, and I know that you have some passions in your field. Tell us about what are the things that you do to help patients with regard to their surgeries?
Well, here, I mean, being this area, this is like in India and Middle East, one of the major problems is diabetes. So most of the people here suffer about diabetes, and this is what actually the field in which I did the most also when I was in Italy, which is diabetic foot
Yes.
care and distal revascularization. That's what I was always been involved with. And so that for me was easy to settle this here.
It's wonderful.
And yes, and we see a lot of patients needing care. And finally, we can treat them here.
So we can Save their legs.
Foot, yes,
save their
foot and
feet.
legs, yes, exactly.
Right, from the ravages of diabetes.
Yeah, also, here in this country, like most of the country around, there is a different culture, so there is no, the people go naked with feet, they don't use shoes. That's such a big challenge in diabetic people, so, that they get mostly injured, or they don't have, by neuropathy, they don't have sensation, so it's easy for them to get injuries, and that set up all the problem of diabetic foot.
Sometimes the earliest sign may be a neuropathy, correct?
It is actually the neuropathy. They don't feel it, so unfortunately there is no pain. Unfortunately, and pain is a great thing that God gave us, because it's a way we know that something is wrong.
Right.
Yeah, diabetic people, they don't have, so they have problems starting, developing, and if they don't look at it, they don't see it.
So I saw that as you took us around the Cleveland Clinic, the vascular lab is right next to all of the ultrasound equipment. And so patients, I think your message may be for patients, to get vascular evaluations early in the game as far as the diabetic patient or even the pre-diabetic patient.
Absolutely. So we are lucky because we have the Heart and Vascular Institute. So all the area, it's covering from heart to peripheral and vascular and to thoracic surgery. So this patient also gets screened for cross specialties. So our patient gets screened for cardiac and vice versa. So this helps a lot. We're getting a lot of now disease in the early stage, which is treatable stage, not too late, which is good. And the facility is amazing. So it's been built in the concept of a Cleveland Clinic with the patient, basically at the center. So it's very easy also physically for the patient to reach the diagnostic, and then from the diagnostic go to the therapy. It's just one path which has been designed rationally.
Easy access.
Easy access, absolutely. This is mandatory in our advanced hospitals. Yes.
For critical care hospitals.
Yeah.
So is there one particular procedure that is quite innovative that you've been involved with, or that you feel that the Cleveland Clinic brings to this area? An innovative procedure with regard to peripheral vascular disease? Yes,
we do all the endovascular therapy. We have laser technology. We have all the basically Western kind of technology. But fun enough, and this maybe looks strange to you, what we really bring, which is innovative, is the old bypass surgery, which is was not really much done, and I think sometimes it's still needed, and that's what we do. And we have also a lot of the venous, of course, part, which is the varicose veins treatment.
Yes,
it's also
including those.
Yes, it's
those
also something we see quite a bit, and we are also involved with some new technology, which is polymer based, which are very advanced into.
Yes, I know one of your teachers or one of your colleagues from the U.S. Your mentor. Would you like to say something about him? Dr. Fraser has been such a force here in the Middle East when he comes.
If we have 12 minutes, it's not enough. He's
good.
Been always a mentor for me. He's a great person, and you're lucky to have him over there.
Yes.
We should bring it over here.
Yes, we
and definitely, but I am biased on him, so the people won't believe me.
At the Texas Heart Institute, yes, Dr. Fraser is one of the pioneers,
absolutely,
I would say. And you were recently involved in a meeting with Dr. Fraser and hundreds of other cardiologists. Can you tell us about the 4TS?
This is a very nice initiative that was actually started from cardiologists in Dubai, and Dr. Fraser as part of our society.
Yeah.
The society where we are both involved, and is the president. And this is now it's 4 years. It's been on, and it's been very successful, and try to bring also faculties from all over the world and new technology and innovative therapies. It's we've been there. You were there as well in February, and it was was excellent as usual.
Yes.
And it's also we're proud because on behalf of our society, so the International Society of Endovascular Specialists, we created here, and I was proud part of it. We created a chapter which is the Gulf chapter, Arabian Gulf chapter of the ICRPS, and that meeting is basically the major event of this chapter.
And it was great. There were hundreds of doctors. So the vision for teaching and training young doctors and maybe older doctors who haven't seen what we're doing, the ability to be all in one room for several days and learn, what a great experience. And
so we both learn. I mean, there is a learn in both ways.
Yes,
because
both ways.
Sometimes you when you live and always work in advanced places, then you lose realities, and
right.
When you come here, you dip into other reality,
Right.
and it's very important for everybody.
What does the village
so
doctor do?
it's two-way communication works very well in education. Absolutely.
Do you have any upcoming events here at the Cleveland Clinic or in the vicinity that you will be speaking at, so that other doctors who are watching, or they may
We have several events in Cleveland Clinic. Also, we have a wonderful setup here for training, which is the simulation center, which we use a lot. And there has been several events. I personally, the next event will be in Holland. But
in Holland. Oh well, that were the
not here for the moment. But we're preparing one here at the Cleveland Clinic for next year.
That's wonderful. Well, I know you'll always be involved with the 4TS, and that'll be also next year. And we just want to thank you for taking the time from your busy schedule. I know you told me that you were on call, and I was hoping that there was not an emergency that would take you away, because it was so important to sit down and talk with you. Thank you for being here and doing what you do for the people, and for giving back.
It's a pleasure.
So
it's a pleasure to see your energy. It's that's amazing. I keep saying that. And thank you for visiting. And anytime you want to come, you're welcome to come.
Thank you. And we will put you back on the show if you do grace us with that next time. All right.
Thank you so much.
Thank you. Thank you.